Hello, doctor. This is Michael Collins, compounding pharmacist and owner of Healthway Compounding Pharmacy in Saginaw. We're on McLeod Drive, just a stone's throw from Fashion Square Mall, and very close to Valley ENT and the other dialysis center, which is just around the corner from us. So we're on McLeod Drive. Stop by anytime. You're always invited to stop in and see what we're all about. So, your first question may be, what is compounding? Well, first of all, pharmacists are all licensed to compound. The Public Health Code sets a job description for both physicians, any kind of prescriber, pharmacists, nurses, etc. And in that Public Health Code description, it talks about compounding. So no matter what pharmacist that you ask about compounding, are they legally able to do it? The answer is yes. However, some pharmacies like mine specialize in compounding, and so that's all we do. We do not dispense any other medications other than compounded prescriptions. So because of that, I think we do it better. I think we spend more time perfecting our craft, so to speak, and we spend more time researching different types of ideas and different types of medications and therapies to give you as a large variety of ammunition as possible. Now, we use active ingredients that are FDA approved. We use and buy from facilities that are FDA approved that sell us chemicals and devices and supplies. However, that's not to imply that any of the products formulations that we compound are FDA approved. They are not. And that's because the FDA really regulates manufacturing, which we are not a manufacturer. We compound one prescription for one patient based on one prescription. We don't make things for the masses. We make things for individual patients that are personalized and tailor-made to their particular condition. And that's the part of the difference between compounding. Now, that doesn't mean we are not regulated, because we are regulated by the Board of Pharmacy. We also have sought out a special distinction, being accredited by the Pharmacy Compounding Accreditation Board. We were actually the first pharmacy in the state of Michigan to seek out PCAB accreditation, and we maintain our accreditation by having them audit us and follow certain guidelines. Standard operating procedures are created, a certain amount of training and testing has to be done for us to maintain that accreditation. So we're very proud of this accreditation, and you should feel comfortable prescribing medications and having them compounded by us just because of those stringent guidelines that we fall under. Now, a lot of times you can think of this as kind of off-label prescribing, because a lot of these FDA-approved chemicals are going to be things that we would use in maybe just another route of administration, or maybe for another type of a use. Now, your second question might be, so why would I write for a compounded prescription? What kind of patients am I going to seek out for that? Well, first of all, let's think about like a bariatric patient that can't swallow tablets or capsules. That bariatric patient would need a suspension created, and we would be the ones that would create that kind of a suspension. We might take a tablet or a capsule or injectable and then turn it into oral suspension. Another situation might be a pediatric patient that needs something like metronidazole, for example. Comes in a tablet form. There's no pediatric dosage form of metronidazole. The hydrochloride salt is very bitter and nasty tasting, so if you were to send it to a traditional pharmacy, they would end up making it that way, and your patient probably wouldn't take it. Whereas we have a metronidazole benzoate salt, which is much more palatable. Put it into like Hershey's chocolate syrup, which a lot of kids love, and we've been able to solve that problem many, many times over by just compounding the metronidazole with the benzoate type of salt. GI pain patients, for example, or GI issues with their pain medications like nonsteroidal anti-inflammatories. We make a lot of topical pain medications, topical nonsteroidals. And this isn't too far from manufactured ideas, because there are commercially available things like diclofenac topical and lidocaine topical. So it's very justifiable to use different medications topically, as we know that even in the manufactured world, they're counting on transdermal absorption to help with their pain. We do a lot of infertility work, making things like hormones like progesterone for patients. If it weren't for some of the things that we make up, some of these ladies would not be able to carry their baby to term. And a lot of times there can be even issues with insurance, prior authorization, because things aren't being covered. And so you might send a patient to me to compound something that the patient is not getting coverage. We may have another alternative that might still be able to help that patient. Now we have like 14,000 different formulas, so it's not like I can create a book or a list because it evolves every day. We create new formulations based on need, based on the problems that you see with the patients in your practice, and different medications that are either off the market or continue to be in short supply, which is another problem that we often solve. So again, if you have questions on anything right now, please direct message me your email address, phone number. You can send me an email at mcollins@healthwayrx.com. That's mcollins@healthwayrx.com. You can send me a direct message on Facebook, as where these are going to be posted. You can call our pharmacy number. You can check out our website, healthwayrx.com, and you will. I promise you, I won't fill your inbox with a bunch of junks like I mentioned before, and also you'll be able to receive some of the rewards that I plan to give out for some of these things. You're always welcome to come and visit our practice site and see what we do. We're very proud of our location. We have many residents and medical students and pharmacy students that tour our facility and spend time here to kind of learn a little bit more about what compounding is. And just as a reminder, I'm still a pharmacist who actually still uses a mortar and pestle in my practice. And so I just want you to have a great day. Thank you for your time for watching this video. This is Michael Collins, your problem-solving pharmacist. Have a great day. Thank you.